What diabetics should do when sick. Health problems such as colds, flu, or illnesses that cause vomiting or diarrhea, bacterial or viral infections can cause high blood sugar. Therefore, controlling blood sugar when sick needs special attention from diabetics. 1. Be prepared in advance. When you have problems such as colds, infections, flu, the body will secrete hormones to help fight diseases. However, these hormones can affect blood sugar, changing blood sugar levels. Some serious infections can lead to dangerous diabetes complications. In addition, when sick, the body can also lose water, affecting nutrition as well as living rhythm. To take good care of their health when they are sick, people with diabetes should have a plan to prepare and consult their doctor for precautions. Questions to ask your doctor for further advice may include: what medicine should you take? When do you need to see a doctor? How does the doctor check blood sugar? What should you do if your blood sugar rises? When should you test for ketones? What should people with diabetes eat when sick? 2. Check stats regularly. Body temperature. You should check your body temperature regularly, because when you are sick, it will easily cause fever, causing symptoms that affect your health. Blood glucose level. People with diabetes should check every 4 hours when sick. If your blood sugar is above 300, you should check your urine for ketones. Ketone testing. If you have type 1 diabetes, high blood sugar levels above 240 mg per deciliter, or your doctor recommends it, you should get tested. Ketones are waste products that type 1 diabetics make when they're stressed or sick. If you detect ketones in your urine, contact your doctor for advice. 3. Fully replenish water. Diabetes can make people more susceptible to dehydration due to fever and diarrhea and lead to electrolyte disturbances and hyperglycemia. When sick, people with diabetes often feel tired and unable to eat, which can be delayed temporarily, but ongoing fluid intake is not to be missed. You should drink 1 cup of fluids every hour to combat dehydration. If your body can't stay hydrated, you may need to go to the emergency room or stay in the hospital for treatment. 4. Notes when taking medicine. If you have type 2 diabetes, you need to be especially careful when taking medication by mouth when you are sick. You should not self-medicate, but consult your doctor and specifically tell you about your diabetes situation. If you need an over-the-counter medicine to control symptoms such as cough and congestion, ask your doctor or pharmacist for a sugar-free product. You should avoid sugary syrup products and be aware that decongestants can affect blood sugar and blood pressure. 5. Eat supplements. In about 3 to 4 hours, people with diabetes should add 30 to 50 grams of carbohydrates to nourish the body, help the body stop producing ketones and prevent excessive hypoglycemia. You can add some carbohydrate foods such as yogurt, quinoa, oatmeal, bananas, apples, oranges, kidney beans, etc. When sick, people with diabetes need to see a doctor in cases such as blood sugar higher than 180 mg per deciliter or lower than 70 mg per deciliter, high body temperature above 38.3 degrees Celsius, diarrhea or vomiting. What people with diabetes should not do when sick: arbitrarily changing the dose of medication. Medical experts stress that people with diabetes should not increase or decrease the dose of medication or insulin without their doctor's prescription. If you notice an unusual rise or fall in your blood sugar, you should contact your doctor immediately for advice before deciding to change your dose. If you cannot take food, you should not stop taking insulin on your own. However, depending on the dose of insulin, you need to eat or drink products containing sugar so that your blood sugar does not drop too low. Ignore abnormal symptoms. You should not be subjective with unusual symptoms such as stomachache, vomiting more than 6 times, frequent urination, dry mouth and thirst, confusion. Not awake, blood sugar rises continuously and exceeds 240, high levels of ketones in the urine. Diabetes is inherently dangerous, so people with diabetes when experiencing other diseases need to pay special attention to their health. In addition to following the above, you need to pay attention to the unusual symptoms to see a doctor promptly.